The measles are so contagious, health experts say it only takes a 1% drop in the vaccination rate to spread throughout the community.
If somebody has measles and they walk into a room with 20 people who are susceptible, 19 of them will end up getting measles. That's how contagious it is.
Measles is airborne. You don't have to have face-to-face contact with an infected person because the virus can linger in the air for up to 2 hours afterwards.
That's what's so scary about some of the recent exposures that we've heard about, including the child who had measles and was at LAX for 2 hours. You can imagine being in an airport terminal, how many people were potentially exposed during that time.
Dr. Dean Blumberg is the division chief of pediatric infectious diseases at UC Davis. He says the best line of defense is giving your child the MMR vaccine at 1 year old and again before kindergarten. You have to show proof of vaccination to attend California schools and licensed daycares unless there is a medical reason.
California doesn't have a personal belief option for parents to opt out on their own.
If you were vaccinated and you know you were vaccinated as a child, you should be, well protected. It does provide lifelong immunity.
The Sacramento County Public Health Department is monitoring the state cases and ready for measles in the capital city. Experts say there's no need for a third shot as an adult, but if you don't know if you're vaccinated, you can take a simple blood test called a titer test.
It tests your blood to see if you have antibodies against the measles virus that would offer you protection. And the antibodies would have come from either a vaccine or from having a measles infection.
Doctors say it's time to take action now to protect yourself and family, pointing out there are more measles cases reported so far in 2025 in the U.S. than the entire year of 2024. In Sacramento, Michelle Bandur, KCRA 3 News.
And health officials say if you suspect that you or your child has measles, don't rush to the ER or an urgent care. You could actually infect the other people in the waiting room. So instead, they say call ahead, and then nursing staff can bring the patient into a side door to be treated. The CDC says there are now 15 states with confirmed measles cases. An outbreak is spreading in 3 of those states. As of yesterday, there were 321 cases confirmed in Texas, Oklahoma, and New Mexico. That is 25 more than on Friday. Texas has the majority of those cases with 279, and the director of Lubbock Public Health fears this could be a year-long concern. Most of those infected have been either unvaccinated or their vaccination status is not known. 38 patients were sick enough to be hospitalized, and a school-aged child in the outbreak area was killed by the measles virus. That child was not vaccinated and did not have any underlying conditions.